a good dose of progesterone can eliminate PMS syndrome. Anyone here have that? Heavy or long periods. We can bring that down to normal. Moodiness, bloating, breast tenderness, headaches, uterine cancer reduction. Now what about hysterectomies? Anyone here have one? Okay. Unless you had cancer, there's not really a big reason to have a hysterectomy. You just give higher and higher doses of progesterone to modulate the estrogenic effects in the body. Now most women that I meet are what we call estrogen dominant. And we have things in our environment and our food and our lifestyle that causes the estrogen receptors to be hit by things. Pesticides do it. Anyone ever heard of dioxins? Chemicals that come from plastics when we microwave food? Be careful, don't ever do that. Don't even have saran wrap on top because it'll actually drip into the food. That's all estrogenic. So, medroxyprogesterone, there we are, that synthetic one. Increased appetite, weight gain, decreased sexual interest, headaches, insomnia, spasm of the coronary arteries. This is one of the major forms of heart attack. It's not from these big plaques that are hard with a lot of calcium. It's from little plaques and from coronary spasm where the arteries just clamp down and we get ischemic and part of the muscle dies in the heart. Acne, breast tenderness, irritability. Also with the sensitivity problems from the medroxy or the synthetics, we actually block the production of natural progesterone. So when I have women come in on birth control pills, guess what their progesterone level is? 0. Guess what their estrogen level is? Very close to 0. I don't know that that's very good. Also, increases the bad cholesterol, low density lipoprotein. What does that lead to? Heart disease. And decreases HDL, the good cholesterol. I don't think any of us want that. Testosterone, we need to look at the total, which is protein bound, to see what storage element there is in the body. We need to look at the free, which is the active form. And most importantly, we need to look at the dihydrotestosterone. Again, this is men and women. The dihydrotestosterone is many times more active than the free testosterone. I have many people that come in, especially men who come in who have been to a urologist who are getting testosterone shots once a month. Do you think that's a good idea? Terrible idea. Terrible. Because what happens is they get a big shot, maybe 400 milligrams. They get real horny and real aggressive, and then they get real depressed the rest of the month. So we don't want to do that. We want to dose it once a week if it's a shot. If it's a cream, which we can do also, we want to dose it daily. Because to get to a therapeutic steady state, we need to do medications on a regular, frequent basis. So what happens with testosterone deficiency? Decreased libido, erection dysfunction. I'm not going to ask how many men have that here. Fatigue, but I could ask the same thing for women. You know, it's really the same issue. Fatigue, muscle weakness. Of course, you need testosterone to keep healthy muscle tissue, keep healthy bone. And as we get older, a lot of our muscle converts to fat. We don't need that. So we want to keep those levels at a constant level. Bone density loss, increased fracture risk, decrease in endurance, stamina, loss of body hair, depression. In my practice, I found that most depression is lack of testosterone, male and female. Mood disorders, same thing. Obesity or increase in fat mass and hypertension. Testosterone supplementation prevents decline in bone mass, muscle mass, strength, mental acuity. Remember, #1 place for receptors for testosterone. Memory, we need that. Libido, sexual performance. Same issues. We need testosterone. Visual spatial performance, visual motor scanning, cardiac health, that's a huge one. Vascular health. Insulin sensitivity. For those of us who have type 2 diabetes, one of the first treatments is testosterone. Brings the sugar way down, brings the cholesterol way down. This is interesting. Exercise physiology, we find that there's a decline in aerobic capacity, which we call VO2 max. That's the ability to utilize oxygen in the body. So we hook people up while they're exercising on a little breathing tube and see how much oxygen that they're using up. Deficiency of testosterone, Less use of oxygen. Less use of oxygen, you're going to be fatigued. Longer recovery times after exertion, decline in response to conditioning activities. Dyslipidemia, meaning that the cholesterols and all the lipids are going awry. All right, so we peak around age 30. Now, people usually feel good into their 40s, usually. They still got plenty left. 50s, not so good. 60s, forget it. We're getting old, right? 70s, you got a good smile, though. By age 70, 40% to 50% of men have low testosterone levels. This is a statistic. I can guarantee you by the age of about 50, most men and women have lost most of their testosterone. And you go, well, how can they have sex? Because there's a big psychological element to sex also. This is the line of hormone decline. It says testosterone, but they're all the same. It's all a nice slide downwards into old age. So men, especially if obese, more of the testosterone is bound to, I mentioned before, sex hormone binding globulin. Very much decreasing hormonal activity. So we need testosterone to remain anabolic. While we're growing, we are anabolic. Our muscles are getting bigger, stronger. Our bones are growing bigger. All of these things are happening. As we get a little older and the hormones decline, we go into what's called catabolism. The body sort of goes down. Do we have to do that? No, we don't have to do that. Protein synthesis decreases with lower hormone levels, especially testosterone. Okay, so when patients come in, they go, I don't want testosterone. My doctor said I'll get cancer. What's the truth in that? Does anyone here believe that testosterone causes cancer? Raise your hand, please. I'd like to know. One person. Good. Okay, so one of the greatest concerns among clinicians regarding testosterone replacement is the fear of causing or promoting prostate cancer. The truth of it? No clinical evidence. This is a study that was done. Okay? No clinical evidence that the risk of prostate cancer or BPH, bigger prostate, increases with testosterone supplementation. Okay? Just like I told you, significant decline in BPH and prostate cancer with higher testosterone levels. Now what we find is if a man has low testosterone, there's a higher incidence of prostate cancer. Shock, right? It goes against the fishwives' tail. Is it called fishwives or fishtail wives? The old wives' tales, thank you. No causal link found between testosterone replacement, prostate cancer, or cardiac disease. It's the opposite. Why do doctors still say that it can do it? Or are they afraid of it? Because that was taught in med school a long time ago before the studies came out. Why don't the urologists read their own studies in their own journals? I don't know. I really don't. I fight with urologists all the time. Can we lower the risk of Alzheimer's disease with testosterone supplementation? Testosterone supplements. They always put may in these studies. They don't want to stick their foot out too far. Yeah. But there are studies with this that show that it does help with memory. Estrogen too. Thyroid, that's a big one. I'd say that probably almost everyone in this room is hypothyroid. Won't show up on your labs. Anyone in this room fatigued? Almost everybody has some fatigue. So there's a thing called hypothyroidism, and there's a thing called subclinical hypothyroidism. Now, the traditional docs will not treat your thyroid unless you fit into, remember the bell curve I showed you? You got to fit into the way down side of the bell curve to get some treatment to make you feel better. What does thyroid hormone regulate? Heart rate, right? It's all about metabolism. Body temperature. Anyone in here get cold all the time? Yeah. Do you ever notice that you're sitting around and you're wearing a jacket and everyone else is in a t-shirt? Think about your thyroid. Cholesterol levels are involved. Weight, vision, menstrual regularity. The list really goes on and on. There was a doc named Broda Barn who wrote a treatise, a book on thyroid disease, and he said almost everything comes from the thyroid. I don't know if that's true or not, but he had studies on it. but we sure